Good morning. With the hour upon us, we're going to get started with our House Health Committee meeting. Devin, can you please call the roll?
Chair Kudrowski,
Here.
Representative Benham,
Here.
Borowski,
Designation.
Boyd,
Designation.
Frankel,
Designation.
Hanbidge,
Designation.
Howard, Khan,
Okay. Designation.
Kozarowski,
Designation.
Mays,
Here.
Freer-Lawton,
Designation.
Sanchez,
Here.
Schusterman, Venkat,
Here.
Chair Rapp,
Here.
Representative Bonner, Borowitz, Brown,
Designation.
Day, Krupa,
Designation.
Roy,
Here.
Rossi, Stair, Twardzik,
Designation.
Walsh,
Here.
Zimmerman.
Here.
You have a quorum.
Thank you, Devin. First up, the chair will call up House Bill 1212, printer number 1360, sponsored by Representative Abney. Patrick, can you please provide a summary of the bill?
House Bill 1212 amends Title 35 to add a subchapter that directs the Department of Health to conduct an educational campaign on the benefits of fatherhood engagement on maternal and child health. The educational campaign is organized into two components. The first is a public awareness campaign, and the second is the developing of guidance for providers. Concerning the public awareness campaign, DOH has 2 years to develop materials and information related to fatherhood engagement. Concerning the provider guidance component, DOH has 1 year to develop and post materials guiding maternity care providers, i.e. hospital facilities, clinics, and insurers, on how to communicate the benefits of fatherhood engagement. Both components will be touching on subject matter that includes educating fathers the importance of a father's role in prenatal, postpartum care, child care, and parenting. Finally, HB 1212 also directs the Joint State Government Commission to develop a report within 6 years of passage of the bill, studying the implementation of the bill's provisions.
Thank you, Patrick. The question is, will the committee report House Bill 1212? On that question, Representative Khan is offering Amendment A01100. Patrick, can you please provide a summary of the amendment?
A0110 removes insurers from requirements as they are outside the Department of Health's jurisdiction, provides flexibility related to campaign and provider materials, and reduces the reporting period from 6 years to 4. It also provides the program implementation is subject to available funding.
Thank you. Are there any comments on the amendment? Representative Boyd.
Thank you, Mr. Chairman. So that it says that it's within 2 years the Department of Health has to do this. Would it really take 2 years to get that done? If somebody could.
My understanding is that, yes, it would take 2 years for the department to get that done, and then an additional 2 years for the report to be put together.
And if it were to be completed in advance of 2 years, certainly that material could be provided. However, I think at the time, particularly at the time of the original drafting, there were extensive requirements for what should be included in the actual materials given to the providers as well as part of the education campaign. And because of that, the thought was to provide more flexibility and time for the Department of Health.
Okay, I mean, I'm supporting the bill, but it just seems like that's a long time to say, dads, be involved, you know? But, okay, thank you.
Thank you. Any other comments from members on the amendment? Seeing none, Chair Rapp, do you have any comments on the amendment?
Thank you, Chairman. I will be supporting this amendment. I think it does streamline the bill as far as reducing the timeline. I think that's important. I do share the representative's concern that it would take 2 years, hopefully. As Erica stated, that that might be not the case, that they could do this in a more timely fashion. So, but I am supporting the bill. And my members, I'm not sure. I do have one no on the amendment, sir.
Thank you, Chair Rapp. My understanding is this amendment is designed to create more flexibility within the Department of Health and to ensure that funds are available. So I would like to ask my members to support the amendment. And with that, we will call up a vote on Amendment A01100. Devin, can you please take the roll?
Chair Kudrowski,
Yes.
Representative Benham,
Yes.
Borowski,
Designation, yes.
Representative Boyd,
Designation, yes.
Representative Frankel,
Designation, yes.
Hanbidge,
Designation, yes.
Howard, Khan,
Designation, yes.
Kozarowski,
Designation, yes.
Mays,
Yes.
Otten,
Designation, yes.
Sanchez, Schusterman, Venkat,
Yes.
Chair Rapp,
Yes.
Representative Bonner, Borowitz,
Designation, no.
Brown,
Designation, yes.
Day, Krupa,
Designation, yes.
Roy,
Yes.
Rossi, Stair,
Yes.
Twardzik, Walsh, Zimmerman. The yeas are 24, the nays are 2, it passes.
Thank you, Devin. The amendment passes. The question recurs, will the committee report House Bill 1212 as amended? Is there any discussion on the bill? On that question, I will recognize Representative Abney, who is in the audience, to provide some comment on his bill.
Thank you. First and foremost, let me just say a happy belated Father's Day to all the fathers who are out there today. I hope, like myself, you all enjoyed your day. Thank you, Chair Krajewski, Chair Rapp, Chair Frankel, and members of the Health Committee for your consideration of House Bill 1212. This is legislation that was modeled off of federal legislation that was introduced several years ago by Senator Raphael Warnock and then Senator Marco Rubio. So this was a bipartisan effort really to try to figure out how we can engage more fathers to be more participatory in the pre-pregnancy process, the pregnancy process, and then also the post-pregnancy process as well. I think that there is something that all folks who are fathers, they can attest to, that having that father factor and understanding that a lot of times fathers are like pillars, they are like support systems, they're almost like foundations on a house, right? A lot of times when you see a house and you see how beautiful it is, you're not always thinking about or clapping about the foundation. You're looking at the beautiful, the facade or the shutters, or you're looking at the front yard, but realizing that a lot of times the support system and that foundation is really important when the flood comes. It's really important when a storm comes to have a really good foundation. And House Bill 1212 really tries to make a concerted effort to ensure that folks all across this Commonwealth know that our dads matter and that fathers matter. And so like it was mentioned, the PA Dads Matter Act would direct the Department of Health to conduct a public awareness campaign about the importance of including fathers to improve outcomes during pregnancy, childbirth, and postpartum, and to encourage healthcare providers to engage fathers during prenatal care and the birthing process. And so for all those reasons and more, I encourage you all to hopefully be a yes on House Bill 1212. Thank you, Mr. Chairman. Appreciate it.
Thank you, Representative. Before we move into comment, I'd like to also recognize that we've been joined by Representative Twardzik. Thank you for joining us. Is there any general discussion on the bill? Yes. Chair Rapp.
Thank you, Mr. Chairman. Thank you, Representative, and those were very nice and meaningful comments on this piece of legislation. And I certainly believe that the father in any family through the birth process and is very meaningful and can definitely determine the outcome of a child's future. So I appreciate your comments. The bill, obviously very timely, for Father's Day. But as chair of the Pro-Life Caucus, I do want to make one mention about where the father in the state of Pennsylvania is not recognized, and that is the decision that the mother has when she chooses to have an abortion. Obviously, the Supreme Court struck down Roe, but the Abortion Control Act was heard at the Supreme Court level many years ago, and the one issue that was struck down in the Casey case was the spousal notice. And I feel very saddened that for many members and people in the community sitting here today, they recognize the importance of fatherhood, and rightly so, and justly so, for the sake of children across this Commonwealth and for the sake of future children. But I feel that, and hope, that recognizing the importance of the father in all areas recognized in this bill, that fathers will take more of a role, including that very important decision that the state has stripped, and the Supreme Court had stripped, although that's overturned, now in this state. Because I feel, for the health of the mother in that very emotional time, that the support of the father, even in those instances, is critical for the support of that woman after that decision is made. But I want to commend you for this bill. I think it's very important, but I think it's important that we recognize in Pennsylvania that we really do not consider the father in that very, very critical decision. So I want to thank you. I am going to be supporting the bill, sir, and I commend you, and your words were very eloquent. But I do think that is a critical time when we dismiss the support or unsupport, or just say, it's not your decision, and you don't have any part of the decision. But I commend you for the bill, sir, and I will be supporting it. Thank you, Mr. Chair.
Thank you, Chair Rapp. Before we move into comment, we have been also joined by Representative Boyd and Representative Khan. Thank you for joining us. Are there any other comments from members on House Bill 1212? Rep. Walsh? Yeah, please.
All right, thank you. I know I'm learning the rules. I apologize. I should have spoke before you. Anyway, one of my concerns just about bills like this, I think it's well intended, and thank you for bringing it forward, but how do we measure the results? If we run this campaign, one of the things that I always look at in any decision that I make personally or in my previous business is if we can't measure it, we don't do it. So if we're going to create a campaign and put this out there, and I know there's a reporting that's coming in 4 years or 6 years on it, but is this truly measurable, I guess would be my concern. And it's really the only reason I would be a no, because I just don't feel like spending money and not being able to measure something. So I'm just asking you if you've, maybe there's a similar legislation that was passed in a different channel that was measured. If you can add any insight on that, I'd appreciate it.
So as was mentioned in the legislation, there is a report that is supposed to come to the chairs, the majority minority chairs of the Health Committee, as well as Human Services Committee in both the House and the Senate. I think this is one of those situations where nothing is always going to be guaranteed, where you're going to get 100% participation or engagement or activations. But I also think that doing nothing signals that the priority is not as high up on the list. And so I think us moving this legislation signals to the people of the Commonwealth of Pennsylvania that government sees that there is a role that our health department can play in engaging fathers and making sure that they're participatory. And so I think it is one of those situations where, again, you're not going to get 100%, but it is certainly worth the effort.
Erica?
If it's helpful, just there are certain things within the legislation that can be measured. For example, screening of fathers for depression is clearly measurable outcome, as well as I think engagement and participation in visits and things like that. So it's certainly softer than some of our metrics, but there are points within, and the Joint State Government Commission would probably select out those metrics that make the most sense.
Thank you. We've also been joined by Representative Phil Otten. Is there any other discussion from members on House Bill 1212? Yes, Representative Mays.
I want to start by saying happy Pennsylvania Momnibus Day. House Bill 1212 is a part of the Pennsylvania Momnibus legislative package. So honored to have Rep. Abney, the maker of the bill, be the prime sponsor and to really truly engage dads in the process of pregnancy before, during, and after birth. Thank you, Rep. Abney, for being an active member of the Pennsylvania Black Maternal Health Caucus, and I urge my colleagues to vote yes on House Bill 1212.
Thank you, Representative. I would like to echo Representative Mays' comments. I want to thank you, Rep. Abney, for introducing this important legislation and taking leadership in raising the standard around fatherhood engagement. I think it's exciting and very complementary to the exciting Momnibus work and making sure we bring families together. So I appreciate you sponsoring this and looking sharp while doing it. So thank you. So I ask my members to vote yes. And with that, Devin, will you please call the roll?
Chair Krajewski,
Yes.
Representative Benham,
Yes.
Borowski,
Designation yes.
Boyd. Yes. Frankel,
Designation yes.
Hambidge,
Designation yes.
Howard. Khan,
Yes.
Kozarowski,
Designation yes.
Mays,
Yes.
Friel-Otten,
Yes.
Sanchez. Yes. Schusterman. Yes. Venkat.
Yes.
Chair Rapp,
Yes.
Representative Bonner, Borowitz,
Designation no.
Brown,
Designation yes.
Day. Yes. Krupa,
Designation yes.
Roy,
Yes.
Rossi. Yes. Stare.
Yes.
Twardzik,
Yes.
Walsh,
No.
Zimmerman.
Yes.
The yeas are 24, the nays are 2. Bill is reported out of committee.
Thank you, Devin. House Bill 1212 will be reported as amended. Congratulations. Thank you, members. Next up, the chair calls up House Bill 1234, printer number 1468, sponsored by Representative Mays. Dylan, can you please provide a summary of the bill?
House Bill 1234 provides for Medicaid and CHIP coverage of medically necessary blood pressure monitors for pregnant and postpartum enrollees. The blood pressure monitors must be clinically validated.
Thank you, Dylan. Is there any discussion on the bill? On that question, the chair recognizes Representative Mays.
Good morning, Chair Krajewski. I want to acknowledge Chair Frankel. Good morning, Chair Rapp. And to all my colleagues of the Health Committee, happy Pennsylvania Momnibus Day. Moms, maternal health advocates, birth workers, healthcare providers, stakeholders, and supporters have come from all across the Commonwealth today, from the urban core to rural communities, for a day of advocacy and support of the Pennsylvania Black Maternal Health Caucus legislative package of bills to save all moms in this Commonwealth from preventable maternal death. We invite you all to participate in our full day of activities, including our press conference at 1 p.m., our panel at 2:30 p.m., and our reception at 4 p.m. House Bill 1234 is one of the many important pieces of evidence-based maternal health legislation to prevent maternal mortality and morbidity by providing Medicaid coverage of blood pressure monitors to track high blood pressure or preeclampsia, which is one of the leading causes of death in pregnancy and in the postpartum period. House Bill 1234 provides a medically necessary and clinically accurate home blood pressure monitor for pregnant and postpartum Medicaid enrollees. In our Commonwealth, Black moms are 2 times more likely to die before, during, and up to 1 year after childbirth compared to white moms. For moms of all backgrounds, 93.5% of the maternal deaths that happen here in our Commonwealth, they are preventable. And this is from our own data from the health experts who serve on the Pennsylvania Maternal Mortality Review Committee. Preeclampsia typically occurs after the 20th week of pregnancy, and it impacts about 5 to 8% of births, contributes to 15% of premature births and deliveries. Preeclampsia, it can stress the heart and other organs like the liver or the kidney. It can affect blood supply to the placenta and cause fluid buildup in the lungs. Preeclampsia can also result in heart disease, seizures, coma, stroke, and high blood pressure later in life. And 42% of preeclampsia medical treatment in the United States is paid by Medicaid. So the question I continue to ask, and the question that our caucus continues to ask, is why are we as a legislature, healthcare system, and Commonwealth not preventing these maternal deaths? The power to change the trajectory of maternal death and sickness is in our hands. We in the Pennsylvania Black Maternal Health Caucus intend to do everything in our power to transform the lives of all moms in our Commonwealth. So today is an important step. It is an important step in our legislative process to continue our shared and collective fight across this Commonwealth for maternal health. And I ask for an affirmative vote on House Bill 1234 and for all of us to get on the Pennsylvania Momnibus. Thank you so much, Chair.
Thank you, Representative. Are there any other comments on House Bill 1234? I will recognize Representative Schusterman, and I see Representative Roy as well.
I think what's so important about this bill is, one, the staggering statistics that you laid out. And secondly, soon-to-be moms are very busy, and we have to make sure healthcare meets them where they are. So I will be an affirmative with this bill. Thank you.
Thank you, Representative. Next, we have Representative Roy, followed by Representative Khan.
Thank you, Mr. Chairman. Now, it's already law. They already get a blood pressure cuff every 3 years, I think is the current law. This would make it for every pregnancy. I'm not sure why they can't just keep using the same one. Like, it doesn't seem like they'd wear it out. And the medical assistance, Medicaid line items are billions of dollars in the budget, probably around $10 billion. The budget proposal has a $5 billion deficit spending number, taking money out of surplus in the rainy day fund. So I just don't think we're in a position where we want to add cost to the budget. Plus, just a couple years ago, we changed the law. Every 3 calendar years, you can get a blood pressure cuff. So I'm going to be a no vote. Thank you.
Thank you, Representative. Next, we'll have Representative Khan, followed by Representative Day.
Thank you, Mr. Chairman. Thank you, Rep. Mays, for leading in this space. Also, Rep. Curry is here, also from the Black Maternal Health Caucus. I think, you know, it's clear that these disparities, the maternal health mortality and morbidity, the disparities are driven by race. And unfortunately, Black women are, I think, 3 times more likely to die of preventable causes around birth than white women. And for something as inexpensive as a blood pressure cuff, we can prevent these deaths from occurring. I think as a healthcare provider, a couple things stand out. The first is that this is something that probably, if you go on Amazon, you could spend $35, $40 on a blood pressure cuff and probably get a good one. The important thing, though, is that people are actually using that. And what happens is, I can tell you, is that sometimes if you use some of these devices a lot, after a while they become less accurate. Also, the technology keeps getting better, and for a very small cost, you can make sure that you're getting an accurate blood reading. Another thing too is if you misplace your machine, if it's every 3 years, you're not going to be checking that blood pressure. And when you think about what it costs to have an inpatient hospital stay, it's probably $30,000, I would say. And for a $30 blood pressure cuff, I think that's maybe a 1,000-on-1 investment. So even if we're preventing one hospitalization, it's a good bang for the buck, to say nothing of protecting women's lives and babies' lives. So I think this is a great bill. I think it makes a lot of sense. And I just wanted to speak as a healthcare provider, because I can tell you that it happens a lot. Even a blood sugar machine where someone, they lose the sensor, they misplace it and they never use it. We want to make sure that these are getting used at such a low cost for a blood pressure cuff, almost always under $50, and you can get a pretty good one. So thanks for this bill. Thanks for leading in this space. I appreciate it.
Thank you, Representative. Next, we have Representative Day, followed by Representative Venkat.
Thank you, Mr. Chairman. Mr. Chairman, and to the maker of the bill, this is a great bill. I really appreciate you bringing this before the legislature. Preeclampsia affects not only the child, but the mother as well. And you can have some terrible outcomes for the child and for the mother as well. So step one is knowing that there's an issue. And this bill helps with step one. It also, many of us have the ability to go on Amazon, as the previous speaker said, and do that. But covering this is really part of making our healthcare system work for everyone. And I think this bill, although, I asked the same questions my whole career in the private sector and public sector about how we pay for things, and I certainly appreciate my other colleagues' comments about that. In this case, the main thing I wanted to say in my comments was that it's step one. Many of my friends on the other side, when I say we need to do more, they're always ready to do more, probably more than I'm thinking about, but there is more we need to do here. This just lets people know. I have people in my district very close to me who knew they had high blood pressure and went to the hospital and were sent home and had very terrible outcomes. So this is step one. There's more. I don't know if it's education among our healthcare professionals or what it is, understanding this condition better for moms and babies. So I just want to say I'm supportive of this bill, and I think there's another step to be taken as far as this terrible, terrible, hidden, quiet killer. So thank you very much.
Thank you, Representative. Next, we have Representative Venkat.
Thank you, Mr. Chairman. I just wanted to answer the question from Representative Roy, and also thank the maker of the bill, because I think it's an excellent piece of legislation. In general, manual blood pressure cuffs need to be calibrated every 6 months, and automated blood pressure cuffs need to be calibrated every 2 years. So every 3 years providing a cuff is not adequate, especially in the context of a condition like preeclampsia and eclampsia, and especially postpartum preeclampsia and eclampsia, where awareness of the disease and the need to be monitoring for those complications that you may not have experienced during pregnancy is extremely important. And like Representative Khan, as a health professional who's treated patients with preeclampsia and eclampsia, an ounce of prevention absolutely is much more worth than the price that happens when someone comes into the emergency department with this condition. So I am proud to support this bill, and I believe that the provision of a blood pressure cuff, given the calibration requirements that are there, are absolutely appropriate.
Thank you, Representative.
Mr. Chairman, could I be recognized again very quickly? Two of our colleagues had talked about the cost. I just want our colleagues to understand, I want to define that a little bit better. If you're 3, 4, 5, 6, or 10, maybe up to 8 weeks before your due date, you could be hospitalized. That's the cost they're talking about. So that's, I think it's important to know that. And a day in the hospital, as we all know here, anybody who's spent time out here looking at the costs of healthcare, you know, a day in the hospital is much more expensive than the average of, or probably all of these cuffs. So thank you, Mr. Chairman, for recognizing me again. I appreciate that.
No problem. Thank you. Representative Rossi.
That's okay. Thank you. As a mother that went through 12 pregnancies and I have 8 living children, I just want to say I would not have needed 8 different or 12 different blood pressure cuffs. Most of the things, you know, that I went through my first pregnancy, if the doctor felt I needed something, he would prescribe it. And right now, the current bill already permits you to get this. So cost-wise, I don't see a need for this for every pregnancy. So I'm going to be a no.
Thank you, Representative. Are there any other comments on House Bill 1234? Representative Rapp. Chair Rapp.
Thank you, Mr. Chairman. I supported this bill last session, and Representative Mays, I commend you for sponsoring the bill again. I certainly believe in providing assistance that we can for expectant moms, for all expectant moms, so that we can have healthy moms and healthy babies. So, Mr. Chair, I will be supporting this piece of legislation. I think the prime sponsor laid out all the issues very well, but I do have a couple no votes, I do believe. So, but thank you, Representative.
Right.
Thank you, Mr. Chair.
Thank you, Chair. I'd like to thank the representative for your leadership on this bill and just the issues of maternal health generally. I also know Representative Curry is here in the audience. It has been exciting to see you take up this space of advocacy around maternal health in our caucus and in this chamber. I've learned a lot from your advocacy, and I know our members have learned a lot, and you're making real change in terms of supporting at-risk mothers and getting the support they need. So thank you. I continue to look forward to literally and figuratively being on the omnibus, and I'd like to ask my members for a yes vote. And with that, Devin, we will call the roll.
Chair Krajewski. Yes. Representative Benham.
Yes.
Borowski.
Designation yes.
Boyd. Yes. Frankel.
Designation yes.
Hanbidge.
Designation yes.
Howard. Yes. Khan.
Yes.
Kozarowski.
Designation yes.
Mays.
Yes.
Friel-Lawton.
Yes.
Sanchez. Yes. Schusterman.
Yes.
Wenkat.
Yes.
Chair Rapp.
Yes.
Representative Bonner. Yes. Horowitz.
Designation, no.
Brown.
Designation, yes.
Day.
Yes.
Krupa.
Designation, yes.
Roy.
No.
Rossi. No. Stair.
Yes.
Twardzik.
Yes.
Walsh.
No.
Zimmerman.
Yes.
The yeas are 22, the nays are 4. Passes.
House Bill 1234 will be reported as committed. Congratulations, Rep. Thank you. Next up, the chair will call up Senate Bill SB 411, printer number 510, sponsored by Senator Vogel. Erica, can you please provide a summary of the bill?
Senate Bill 411 creates a statewide stroke registry to track performance of stroke care centers. The Department of Health may contract with a national evidence-based third party, such as the American Heart Association, to receive, store, and maintain the data. The registry shall be published on the Department of Health's website. Designated facilities providing care for patients with strokes must provide their data to the stroke registry, which will be updated twice yearly. And the centers included in the legislation are comprehensive stroke centers, thrombectomy-capable stroke centers, primary stroke centers, and acute stroke-ready hospitals.
Thank you, Erica. The question is, will the committee report Senate Bill 411? On that question, Representative Sanchez is offering Amendment A01083. Erica, can you please provide a summary of the amendment?
Amendment A01083 defines thrombectomy-capable stroke centers, creates patient confidentiality requirements, and makes technical changes in the bill to ensure uniformity and clarity.
Thank you, Erica. Will the committee agree to the amendment? On that question, the chair recognizes Representative Sanchez.
Thank you, Mr. Chairman. Nothing much more to add to that, just a definitional clarification on the thrombectomy-capable stroke center, and just making a minor improvement to the bill in regards to confidentiality and a couple of technical changes. That's all.
All right, thank you, Representative. Are there any other comments on the amendment on that question? We'll recognize Chair Rapp.
Thank you, Mr. Chairman. This amendment does streamline the bill, provides clarification regarding data collection and confidentiality. I will be supporting the amendment. Thank you, Mr. Chair.
Thank you. And my understanding is this is an agreed-to amendment?
Yes.
Yes. I'd like to ask my members to support.
I have
Oh, you have.
No, she's yes on it. Sorry. Yes, as far as I know.
Okay, thank you. Thank you. So if there is no opposition to the amendment? No? Okay. Then the amendment will pass. And we'll report Senate Bill. Oh, nope. Yes. Apologies. So now the amendment passes. The question recurs. Will the committee report on the bill as amended? Is there any discussion on Senate Bill 411? On that, we'll recognize Chair Rapp.
Thank you, Mr. Chairman. Providing data to be used by healthcare providers, including EMS personnel, will increase the provision of high-quality stroke care. By continually tracking, measuring, and improving upon stroke care, healthcare providers can increase the quality and the access to the care they provide to stroke patients. I do have some concerns about the differing fiscal note projections for this bill. The Senate fiscal note indicated that there will be no fiscal impact to the Commonwealth and that the Department of Health can accomplish these administrative services with current complement and budgetary levels. However, in a fiscal projection received from the Department of Health, we were informed that the department projects this bill will cost approximately $345,000, which equates to $200,000 for informational technology requirements and $145,000 for one-time, full-time equivalent employee for a program administrator. So as this bill progresses through the legislative process, I would like to see further clarification on the fiscal impact of this bill and whether the department is seeking additional funds for this bill or not. However, at this time, I will be supporting moving this bill out of committee. Thank you, Mr. Chair.
Thank you, Chair Rapp. We will also be supporting Senate Bill 411 and ask my members to vote yes. And with that, Devin, will you please call the roll on Senate Bill 411?
Chair Kuczewski. Yes. Representative Benham.
Designation yes.
Borowski.
Designation yes.
Boyd.
Yes.
Frankel.
Designation yes.
Hambidge.
Designation yes.
Howard.
Yes.
Khan.
Designation yes.
Kozarowski.
Designation yes.
Mays.
Designation yes.
Frialaten.
Yes.
Sanchez.
Yes.
Schusterman.
Yes.
Venkat.
Designation yes.
Chair Rapp.
Yes.
Representative Bonner.
Yes.
Borowitz.
Designation no.
Brown.
Designation yes.
Day. Yes. Krupa.
Designation yes.
Roy.
Yes.
Rossi.
Yes.
Stare.
Yes.
Twardzik.
Yes.
Walsh.
Yes.
Zimmerman.
Yes.
The ayes are 25, the nays are 1. Senate Bill 411 passes.
All right. Thank you, Devin. Senate Bill 411 will be reported as amended. Next up, we will call up a pair of House resolutions. First up for consideration is House Resolution 235, sponsored by Representative O'Mara, recognizing July 25th, 2025 as World IVF Day. And the question is, will the committee report House Resolution 235? All those in favor of reporting House Resolution 235 will vote yes. Those opposed will vote no. Are there, seeing no opposition, House Resolution 235 will be reported as committed. Next up for consideration is House Resolution 255, sponsored by Chair Rapp, designating the week of September 21st through 27th, 2025 as Surgical Technologist Week. Technologist Week, there you go. The question is, will the committee report House Resolution 255? On that question, I recognize Chair Rapp.
Well, thank you, Mr. Chair. As every other resolution, we know people in our communities and professionals, and I think this is very important to recognize the expertise of our surgical technologists. So I would very much appreciate a positive vote on this resolution, and thank you, Mr. Chair.
Thank you, Chair. Is there any opposition to House Resolution 255? Seeing none, House Resolution 255 will be reported as committed, and seeing no further business, the House Health Committee voting meeting is adjourned.